Good afternoon, everyone. Welcome to our Leadership in Action series. I am Monica Paquette, and I am the advising coordinator for the OMPH program. Some of you may have already met me, especially through email. Right now, Brenda Brackett and myself are facilitating this evening because our new program director is in Kenya working on a research project. And you're in good hands because this evening we're introducing you to Karen Andes. And just to give you a little background on the Leadership in Action series, we are celebrating the idea that we have such a we have contact with a big range of working professionals. Many of them are MDs, DDS. They have MBAs, Masters in Social Work, PhDs, and we thought, why don't we introduce these to our students and give you an idea of what's out there. Karen is the director of the Masters of Public Health program and an associate professor of behavioral sciences. And Karen also she works for, of course, the Brown University School of Public Health. And she is broadly trained social scientist with 3 decades of experience in public health research, training, and practice. She has worked extensively on adolescent sexual and reproductive health, positive youth development, health disparities in African American and Latinx communities, and the social deterrents of health. She has worked on public research and service projects in Paraguay since 2005. As a qualitative methodologist, she had provided qualitative analyst expertise for teams working on a variety of issues, including pediatric oncology, emergency preparedness, COVID vaccine hesitancy, HIV, AIDS, and menstrual hygiene management, among others. She is a certified trainer for MAXQDA. Karen, you're going to have to explain that one to me. Okay. Qualitative data analyst software, and is the author of a 3-course specialization on qualitative research methods for public health on the Coursera platform. So if I mangled any of that, Karen, please don't hesitate to edit. And that's Karen. And we have our own students tonight who will be moderating. We have Zoe Logan, we have Tommy Alfeo Moya, and Grace Keller. Grace is not pinned on. And Tommy, I'm going to pass it on to you to take it away.
Thank you so much, Monica. My name is Tommy. I am a medical doctor and an MPH candidate here at Brown. I'm a proud queer Hispanic man. My pronouns are he, him. I am originally from Costa Rica, but now I live in Toronto, where I work as a stem cell transplant physician at Princess Margaret Hospital. And my main interests are, to advance cancer care for minorities, such as newcomers, Hispanics, adolescents, young adults, and members of the LGBTQ community. Back to you, Monica.
And on to Zoe.
Yeah, of course. Thank you so much. My name is Zoe Logan. I am also an MPH candidate here in the online MPH program. My pronouns are she, her. I am a member of the LGBTQ community and racial equity work group for substance use in Rhode Island. And I have worked in community health, specifically in substance use health equity. I'm a student and a staff member here at Brown University within the Cass Center for Alcohol and Addiction Studies. And I am working as a senior research assistant in that role, as well as completing a longer internship through the program, which I think we could all embrace at this point. I'm really passionate about bringing qualitative insights and influence into more quantitative data spaces. and using that to advance research, especially in those intersections for substance use disorders and disparities. So really happy to be here and to get to ask Karen some of my burning questions from when we had to learn all this qualitative work from her.
Very
think-
good. Much better spoken than I could have done that job. Good job. Grace?
Hi, I'm Grace Keller. I'm originally from Philadelphia, but I live in Vermont now. My pronouns are she, her, and I am also a candidate for the Masters in Public Health program, online program. I have spent 15 years or more working in harm reduction. So I've overseen syringe service programming, low barrier buprenorphine access, and one of my more recent, well, it's been a passion throughout, but one of my focuses more recently has been legislative work. And I'm happy to say that, like Rhode Island, we will now be doing an overdose prevention center, which took quite a bit. We had to override the governor's veto, which we did. So I'm excited to be at Brown for this time period and really learn from Rhode Island, because I know that that's the direction that Rhode Island is going, and Brown is really leading the charge in that. So yeah, that's me. I have always worked in drug user health and advocated for people who use drugs, and tried to expand services and reduce stigma. So thank you so much for having me.
Thank you, Grace. And Tommy, would you like to start the questioning?
Absolutely. So, Dr. Andes, I was wondering if we could start discussing a little bit about your early life and influences for your career. So could you share a little bit with us some details about where in your early life and how your early environment influenced your decision to pursue a career in public health?
Thanks. So I'm one of those people who moved around a lot when I was growing up. So it's really kind of hard to say where I'm from. Both my parents were born and raised in Pennsylvania, but I never lived there. I have lived a decade in Buffalo and then a decade in Phoenix, another decade in Chicago. Obviously, I don't choose my places by the weather. Then 2 decades in Atlanta and have just moved here. So there's another decade in there somewhere, but don't count too carefully. And to be honest, public health really wasn't on the radar until I was in my early 20s. My father, strangely enough, he was an electrical engineer and he worked on medical equipment. So he actually worked on the pacemaker in the early 70s and also on electrocardiograms and ultrasounds. So every so often we would have these little machines come home and we'd try to visualize our stomach or whatever on the ultrasound machine. So there was some exposure there, and I was always, fascinated by that stuff. But really, I wouldn't say public health was clearly on my radar until I was in my 20s.
That's I think it's a background that a lot of our public health instructors and faculty share. That is, life was what brought them to public health. Could you tell us a little bit about, what experiences would you say were crucial or instrumental in shaping your career in public health? And did you ever had any mentors who provided advice or guidance?
Sure. Well, I'll start by saying that I had a pregnancy scare when I was straight out of college. I eventually wound up volunteering with Planned Parenthood. I was doing pregnancy testing and counseling. And then I worked as a healthcare assistant in the clinic for a summer, taking patient histories, drawing blood, all that kind of good stuff. And I really enjoyed it. Grad school then was really a feminist awakening for me, which also made me think much more critically about reproductive health and justice. After my second year in grad school, I decided to take a leave of absence. Ironically, I wasn't sure I wanted to be an academic. It's kind of funny looking back on that now. So in this leave of absence, I took a position directing a community health program on the north side of Chicago for 2 years. And in that program, I managed both a volunteer dental clinic and a community health worker project. As far as mentors, I've had mentors along the way. I think probably the most important advice I got for a mentor when I was in grad school was to stop comparing myself to my mentors. I think that was a really important piece because I was always, trying to be as good as they were. And they were like, well, we've got 10 to 20 years on you, so don't expect to be as good as we are right now. So that was helpful.
And that is a piece of advice that I could use myself, and I'm pretty sure a lot of members of the audience will do too. Is there any location or can you pinpoint a specific point in your career when you began to actually conduct research in public health? And if you can actually pinpoint that point in your career, what was it that led you to branch out to this field?
So I was actually, my PhD is in political science. I had started the program at Northwestern. I took a year off to do an internship in basically political and economic development. And then I decided to start the PhD program in political science. And there I was particularly interested in economic and political development in developing countries, mostly of Africa and Latin America. I also took a number of courses on demography while I was in grad school and wound up writing my dissertation on the agricultural economy and fertility decline in Tunisia. So I was kind of looking at this classic common sense notion that farmers have a lot of kids because they need labor on the farm. To me, it never really made sense. I was always like, okay, well, the apples are just about ready, honey. Let's go have sex and wait 10 years till the kids can help us with the harvest. Just didn't quite make sense to me. So I did a lot of interviewing around fertility histories, family planning use, and the agricultural economy, and basically found that people were not filling their labor needs with their children. They were using other methods to fill their labor needs. So a lot of what I found was that I looked at two communities, and in one of the communities, fertility declined largely as agriculture constricted. So as agriculture declined, fertility did as well. In the other region, agriculture was booming and actually growing, and they didn't have the same kind of hardship that would cause fertility to decline. So I spent 6 months in Tunisia in 1993 and another year there as a postdoc in 1994-95.
Oh wow, that's and now it seems to be that women's health for sure is a focus of your research. How did you eventually choose women's health as a specific area of research, and how would you say this focus has evolved over time?
So what's funny is that, I really started with women's health. My whole career in public health kind of started there. And with my growing emphasis on feminism, it stayed there for quite a while. But I found over time, and over time, I mean over the course of about 20 years, my interests, the population of interest started getting younger. So where I was concerned with women of all ages, I started moving to young adults in particular, and then adolescents, and eventually got on to preteens. So my most recent work on sexual and reproductive health and comprehensive sex education and interventions, I really think they need to start in the 10 to 14 year age group. And that's where a lot of my work has kind of landed in the last probably decade. It's also spurred a shift in my interest towards positive youth development, largely because, when you're looking at 10 to 14-year-olds, the risk and protective factors are similar across a number of different health outcomes. So whether it's drug abuse, whether it's, it can even be eating disorders. A lot of the risk and protective factors are similar across various outcomes, and a lot of what we can do to build positive youth development among young people actually helps build protective factors and reduce risk factors over time. And I think it's especially effective to look at this younger age group because you can address multiple outcomes at the same time.
Oh, well, that's fascinating. In your career, can you tell us a little bit of is there any specific or significant challenge that you face in your career, and can you tell us how you made it to overcome it?
Well, in good feminist fashion, I followed my then husband to Atlanta when he got a job at the CDC. And that was one of my biggest challenges. I had actually been teaching at the American University in DC, and was pregnant with my son. I had my son in 2001. And my husband got an offer at the CDC. Actually, the same day that I went into labor, I think my son was looking for job security. But moving both with an infant and following my husband was not kind of the way I imagined my career unfolding. And it took a little time really to piece together the different pieces that I wanted. So I worked at CDC part-time starting in 2002. I started teaching at Emory part-time in 2003. And it took about 5 years of doing this and that in different places at CDC and Emory before I could really consolidate everything under the rubric of a position at Emory. Ironically, I was a visiting professor at Emory for about 5 years, although nobody knew where I was visiting from.
Well, that's fascinating. And then finally, to conclude this section, could you comment in your many years as an academic in public health, what's your perspective on the intersection of, academia, the industry, and policy and governments?
So I've worked in all of these areas, except really policy. And I think I've come to appreciate academia more over the years, largely because there's more freedom than there is in government or nonprofit organizations or even in industry. It also means there can be more stress, at least some of the time. So, when you're writing grant proposals for your supper, basically, there is stress associated with that, but it's quite different. I mean, one of the things I love about academe is the last couple of years, I got really interested in homelessness. And I don't have a boss telling me I can or cannot start working on homelessness. I get to do that just because I want to. And that's a huge benefit of being in academia over other fields.
Yeah, that is quite wonderful for sure to have that freedom. Thank you so much for your insights, Dr. Andes. And Monica, I'm gonna give the floor back to you.
Thank you, Tommy. Very interesting. We're going to continue with, let's see, Grace, you're next. Would you like to ask Dr. Andy some questions? All right.
Perfect. Thank you so much. And I might pivot a little bit to just because there might have been a little overlap, and I want to hear about homelessness. So in your work in reproductive health, you've had the opportunity to see applied public health in action, both in the United States and globally. Can you speak about your global experience, which I know you already did a little bit, but
that's all right.
maybe a little more.
So I've spent a significant amount of time working on these issues in both Tunisia and Paraguay. So a little bit different in each place. Tunisia, I was there intensively for 6 months and then a year. Whereas Paraguay, I started working in Paraguay in 2005 when my son was just 3, and I wasn't ready to go somewhere else for 6 months at a time. So much of the work that I've done in Paraguay has come in increments of 2 to 3 weeks at a time, but over a 20-year period. I've also mentored projects in other places over the years as well. Some places that I know well, like other parts of Latin America, and some places that I've never been to, like Bangladesh and India. In Paraguay, my interests also started shifting towards urban health and informal settlements. So in 2009, I started working with a nonprofit organization that serves about 100,000 people who are settled in the floodplains of the Paraguay River in Asunción. This is what you might call the slum if you were looking for a term for slums. And this is, so I can talk more about that if you'd like. But I feel like this interest in housing, because in the informal settlements, people are largely, again, if you're looking for a term for it, squatting. They're folks who are living on land that is not theirs legally, and so they may get pushed off at any point in time. And because it's undesirable land as flood land, folks were able to settle there. This is the sort of Paraguayan's context, but as I've come back to the States, I feel like looking at homelessness is kind of the analogy. It's the similar slice of society that I can be looking at here.
Great. Well, and my next question, I think I will, hopefully, it's okay that I just adapt, but I would like to hear more about your work with homelessness in the United States.
Sure.
What brought you there, and what you're doing and how that's evolving. Sorry to pivot, but it's really exciting.
No worries at all. So my interest in housing has been there for quite some time, but it was really when I came to Providence, I had the sort of serendipity of meeting a social worker who has been doing this work for about 18 years. And the group that she works with opens up outreach, so you can sign up to go out with them to do outreach in a variety of different places, largely in the encampments around Providence, or places, street locations where people congregate. So I've been doing that for almost a year and a half now, going out to do outreach and really just become familiar with the situation. We started a small photo voice project in March in one of the encampments that had about 30 people living there. Unfortunately, around the time that folks were supposed to bring cameras back to us, they were evicted from this location. Some of you may have seen in the news, there were 2 encampments that were evicted about a month ago, a little over a month ago. So now we're in the process of finding people again. There is one person, however, that I've got a really nice connection with, and we've started doing some intensive interviewing. So we're going to be doing some interviewing. And when I say intensive, I mean it's going to take probably a couple months of Friday morning meetings. I may write a book called Fridays with Angelo. Who knows?
Yes, I've done a lot of work with homeless folks here in Vermont, and so when I saw that on your answers, I had to ask, and I always think it's so great to have a connection, like a social worker that can bring you, bring you in, and then if people are gravitating towards you, that's definitely a good sign for your openness and your person-centered approach. And so I think that's really awesome. And I do love the idea.
You have to really be ready to meet people where they are.
Yeah, exactly.
Absolutely. Mm-hmm.
Non-judgmental. And I love that you could just pivot, like what you're talking about with academia, where you can just sort of pivot to a different interest, because I have very similar feelings where I get excited and then want to follow those roads. So
yeah, sure.
we were gonna congratulations on your recent appointment of the director of Brown's MPH programs. I know all of us who'd had classes with you were very excited about that. What drew you to Brown first, and then to the position as director?
Well, it's funny, I really was not looking for a new job when I saw the announcement for Brown. A friend of mine at Emory, where I had been for 20 years, forwarded it to me, and she, her note was, "As much as I'd hate to lose you, this job sounds like you." And when I read the announcement, I thought, yeah, it kind of does. And I thought, what the hell, I might as well apply. I tell students all the time, you're not going to get the job if you don't apply. And if you do get the job and you decide you don't want it, you can always turn it down. Well, by the time I had visited Providence and visited Brown, I decided that I did want it. And it happened that it was a good time. It was an okay time in terms of my work at Emory to be able to make the change. And my son he was still in the house, but he was in college. So, I did kick him out when I moved, and that's not usually how empty nesting happens, but we've survived. So the director position, then, that was advertised about a year ago, and I just knew that I had had a lot of different pieces of service that I'd been involved with at Emory over the years that were in line with what this position needed, and it felt like a really good fit. And I feel like it has been. I'm really happy to be in the position, and I hope I can really start to make a difference in the program at this point.
Awesome. Oh, and I know from being in class with you that you have many other interests and talents. I'd love to hear about your master's in fine arts and your jewelry making, your writing and other creative pursuits, and also how does art and creativity balance or complement your work in public health?
Well, that could be a really, really, really long answer question, but I know we have other questions down the road.
I know we're asking you like reproductive health and then
I know
creative
you're kind of hitting the
pursuits. It's
gamut
like,
here.
yeah.
No, I think that we need to remember to renew ourselves. It's really important. And, for me to do my best work academically and intellectually, I also need to relax. I need to, rejuvenate myself creatively. And jewelry is something that I've been doing for about 5 years. I mean, that's a little bit of a lie. I've worked with beads since I was in graduate school. And you'll appreciate this. This is what we call in jewelry. Beads are what we call the gateway drug. You start playing with beads, and later on you're playing with fire and silver. So just beware. If you think jewelry making sounds fun, beware. It can be really catchy. But for me, it's really fun. I usually will spend about 3 hours at a time at the jewelry studio, and I find that just everything else falls away, and I'm able to just kind of be in the zone and enjoy working. And this is, in the literature, there's this notion of a state of flow. And I feel like I experience that when I'm doing work in jewelry. And it's really rejuvenating for me. The writing is a little bit different. It's more like work. But the nonfiction writing that I do is different than academic writing. It's much more creative. It challenges me to dig deep and portray issues in surprising detail, and detail that may seem out of place in traditional academic writing. I've had to learn how to ask new questions in writing nonfiction, like, what were you wearing at the time? And what color was the house? And, all these kind of visual details that help bring text to life when you're reading it, that, nobody cares about that when you're doing qualitative interviewing. So I've really had to learn how to do a different kind of interviewing for my writing work.
Thanks for sharing. Yeah, there's a lot of balance that I don't always get right. And so it's nice to hear about other people's ways of finding balance and creativity. I think this is my last question because I know Zoe's going to go next. I remember in class that you mentioned speaking multiple language, Spanish and French in particular. How have you found it to be a powerful tool in your work?
So I learned all my languages as an adult, and I do speak French and Spanish both fluently. I've also studied German and Arabic, which I speak quite poorly. Language, I feel like it exposes me to worlds that I can't access in any other way. I know that professionally, speaking Spanish was really important when I was selected to be the director of community health in Chicago back in 1990. My first position at CDC also required French. They were working with qualitative data on maternal to child transmission of HIV in West Africa. Since then, I ran a program at the Mexican consulate that if I had not had Spanish, I wouldn't have been able to do that either. So it's funny that it feels like language has become a tool on the way to other things that I want to do. And it allows me to connect with people in a way that I don't think I could otherwise.
Thank you so much. That's I think my last question, so I'll let Zoe go next, but I appreciate you allowing me to pick your brain.
Thank you, Grace.
Very good. I do see one little question. Maybe we'll have a chance to get back to that, Grace. But right now, let's have Zoe take it away.
Thank you so much. And I think this conversation has been really lovely to build up towards sort of a more focused talk on, how you got to where you are now and what you're doing now and what sustains you now. And so I'm thinking, talking about leadership, I think about change. I think about the concept of change. Our leaders in our communities, especially community health, are the ones who are kind of charged with leading that change. And so we know we're relying on them, relying on you, especially as our director for the MPH program now, to tell us, where do we need to go next? How do we advance science as new professionals? And then also, how do we embrace modern discoveries within science as we're going along and teaching new people? I think in academia, that's something that has been really surprising to me, is we at Brown University especially are right on the edge of learning, like, what's the newest thing that's out there and what's the most profound theory with the most citations and all of that, right? And a lot of that comes from you in the qualitative area, just saying. But when we're thinking about that, it really is the leaders who are telling us, okay, this is where we're going next. And I think a lot about health equity as a big piece of change, right? And the focus and value of qualitative research that has kind of come up in the last, I would say maybe 20 years. I think they take qualitative research a bit more seriously than they used to. I hope you can speak on that a little bit too. But I think my real question here, with all of these themes in mind, is, how do you value your position and your influence as a leader in this area? And, how are you embracing these changes and kind of pushing those forward in your work now in your position?
So in terms of the MPH program, I would say that I've taken the first year as really a listening year. One thing about taking a leadership position at a school that's new, in some ways it's really fun because you are bringing a different experience into the school. And I've been able to bring ideas from Emory, but also just the creativity of being in a new environment and saying, that's how this works here. That's really interesting. To be able to kind of see the way things work and how things are different, and think about ways that, I've learned that certain things that have happened in the program, the MPH program here, have happened because of the way it's evolved over time. And it makes sense when you look at it within that historical perspective, but it doesn't necessarily make sense when you look at it in a cross-sectional way and say, this is where we are. Wonder why that is. And is that best serving our needs? So it's really nice to be able to bring sort of a new perspective and a new set of lenses to the school. I think my style of leadership is very much a connected style of leadership, and one that focuses a lot on listening and facilitating more than imposing my own opinion on things. So it's really been a year of learning who people are, what they're doing in their positions, what they'd like to be doing more and less of, and finding ways to help bring out the leadership in other people around the program.
Yeah, that's great.
Your question, but
no, that's fantastic. I mean, it's a very democratic leadership approach, right? Where we're using our strengths to build on all of the knowledge you already hold inside your giant brain. So that's fantastic. As I think about your experience, and we've talked a lot about the different areas you've worked in, what I was really drawn to when I took your class to begin with and had you as a professor was your qualitative research and the focus you've had on disparities specifically. And now that, you know, health equity is such a center, we even have health equity scholars at Brown now, which is fantastic. Now that that's sort of a huge center of, you know, how we move forward with public health in a lot of different veins, whether it's cancer research, whether it's substance use treatment, right? We're all focusing so much more now on how can we bring the influence of that qualitative information, and how do we value that appropriately within the spaces where we're trying to actually execute, you know, science or research questions in general. So I'm really curious about your opinion on the value and like the efficacy behind health equity in the space of qualitative research, and in qualitative, you know, study as you're developing as an MPH student, right? Can you talk about, you know, why you choose qualitative and how that impacts the work that you do with disparities in health equity?
Sure. I mean, part of what I love about qualitative research is that it allows you to learn about the unanticipated and the unexpected. I feel like health equity in a very deep way is related to difference. You know, we are different from each other, and that's beautiful. But we tend to lose sight of that, and we tend to try to find similarity. And I feel like qualitative helps me unearth new insights because I don't go in with the same assumptions that I do when I structure questions for participants, and especially when I structure answers. So, you know, a lot of quantitative methods, you're not just structuring the question, but you're saying choose from these 4 answers, and that's all you get. And sometimes the answer really is something that you didn't anticipate at all. And you can't understand the context of the issue that you're looking at if you don't look at it in a qualitative way, or you don't ask people themselves what their understanding is of that phenomenon. So that's what I love. And that's, you know, right now, that's exactly what's really fascinating to me about doing this interviewing around homelessness is I'm discovering one person's trajectory over, you know, we're doing interviewing around about a 20-year period. He's been in and out of homelessness for that long. And I'm curious. What is it that makes a smart, articulate, personable, kind human being? What is it that puts you on the street, right? So I feel like qualitative gives me the opportunity to be curious in a way that allows me to learn about society and, you know, slices of society that I don't have access to in my own lived experience.
Yeah, no, I think that that's really powerful. I think if we looked at a talk like this 20-something years ago, 30-something years ago, I think the conversation about qualitative research and data would be really, really different.
Yes.
So it just shows a lot of how far we've come in public health, and specifically in DEI, as it pertains to health. So that's really fantastic to hear. Sort of what piece of that drives your interest with the homeless and unhoused communities here in Rhode Island. So as I think about the different intersections with health, what has been another really big area of change aside from this huge focus on equity and qualitative research building has been AI and how AI is impacting not only public health, but public health students and their grades, and all sorts of
Uh-oh.
things, right? So, as we think about AI, I'm really curious, especially given your position as director, what change do you see coming, in your opinion, for public health programs, and the content that, you're going to continue to include? And how do you think we might open it up to have more AI utilized in our spaces, maybe within like health prevention strategies? I'm really saying, there's like a hefty background that you hold in all this software, right? You're a trainer in qualitative software. You have a lot of background in doing the analysis that many people don't know how to do. And so I'm really curious, with these softwares, how do you expect them to maybe use AI, and how are we going to have to use that in the classroom coming forward?
Well, AI is here to stay, I think. And it's not even as new and fresh as we think it is. So the software package that I use the most, MaxQDA, their last version that they released this year, early 24, has a lot of AI functions in it. And I will admit, I was a bit of a skeptic at first. But as I started to see how they used it, I think they've taken a really smart approach. And I think this is what we need to do more generally. I think we need to be really smart about the way we think about AI. What are the ways that it can expand our perspectives on things? What are the ways that it can facilitate our work, but not replace the real thinking that we need to do, right? So what you'll see, and I know the other software packages, Atlas TI and NVivo, are also working towards incorporating AI. Right now in MaxQDA, you can ask MaxQDA to summarize a passage of text for you, and it will do it. It will even do it in a different language. You can tell MaxQDA to read 4 paragraphs in Spanish and summarize it for you in English. And I don't know a whole lot of people who can do that. So it will also suggest codes, and I'm a little more skeptical about that until I've at least worked with it. At the same time, I think as faculty, we need to be careful and really purposeful in how we integrate AI into our work. So I actually have an assignment coming up in the Leadership 2 class where I've asked students to use AI to generate a dialogue around conflict. And then I'm asking students to use the techniques and principles that we're talking about in class to correct that dialogue, to move that dialogue in a better direction. I think there are ways to use AI in a way that stimulates our thinking and doesn't thwart it. And that's the direction that I'd like to see us go.
Yeah, no, I've always been curious. I've heard a lot of people in conference spaces talking about, AI is going to be the change to statistical analysis that the calculator was to algebra.
Sure. I mean, my son's in computer programming, and he's like, he can use AI to help him write code. And that's awesome. I'm sure, anybody who uses SAS, I'm pretty sure you'd like to, or R, I'm pretty sure you'd like to have some help with your code writing, which AI can do.
One in biostats can be very helpful.
It could be.
That's great. I appreciate your openness to talk about AI. I think it's been something that, especially in health spaces, people are nervous about, especially concerning all the health equity work that's been happening. It's alarming to know that we may be sliding back and going back to more of a AI quantitative approach. So it's really interesting to hear sort of where you think we could be going with it, and that you have value, you place value in this area, which is exciting, especially to hear from someone working at Brown, where we're supposed to be on the cutting edge, right? So I'm really curious now, just to kind of follow up this question, but how could leaders, and especially, people like myself and Tommy and Grace who want to be the next generation of leaders, kind of at your level maybe one day, how could we hope to lead and keep up with advancements? How are you doing this? Like how do you keep the pulse of research in all these different intersections that you're looking at?
Well, to me, I think it's part of just lifelong learning. I am a person who I tend to go through shifts. Like I've moved a little bit away from adolescent and sexual and reproductive health in recent years. That doesn't mean I'm not still kind of engaged in it, but I've started to follow the learning curve of something else. And I think we need to do that throughout our careers. I think it's unrealistic to think any one of us is going to work on exactly the same issue for the rest of our lives. Myself, I really consider myself a qualitative methodologist more than a subject matter expert. I mean, I can pass as a subject matter expert on a number of topics, but I've also been brought onto new projects, like topics that I had no idea. Emergency preparedness is a great example. At the time I started, we did a project on the 2009 ice storm in Kentucky and looking at the public health response to that. And I couldn't even read the data at the beginning because there are so many acronyms that I had no idea what the acronyms all were. So I had a whole learning curve to get into the environment of emergency preparedness. But I've learned how to
right
learn.
there. How far into your career were you getting into this and not
About
knowing
10 years
everything
ago.
still?
This was about a decade ago.
Oh, you're making us all feel fantastic. Thank you.
And homelessness is not something, I have not looked at the literature on the unhoused community, particularly the the influence of substance abuse, substance use disorder, harm reduction. All of those things are things that I'm going to have to learn a lot about working in this community, and I'll learn it from folks who want to talk to me about it. I'll do the reading as well, but I'm really interested in learning about the lived experience of, what is it like to live every day with these kinds of concerns.
Yeah, like what is this? I mean, in some vein, it's minority stress, right? And others, I mean, there are just so many things that could be going on. Yeah, it's really interesting to sort of think about all of the intersections now that you will have to do reading up on. And I guess what we're really learning today is reading never stops. We're never going to stop reading all of these articles. And at least we're getting a good education in how to do it, right? So I'm curious.
I would encourage you to read widely also. Don't just stay with your academic stuff, but there's a lot of other good stuff out there too to be reading.
Yeah, I mean, that's how we find so many great intersections in health, right? Like the arts and mindfulness coming together. That's fantastic work right there. So you have been with Brown in your position not very long now. But when you imagine, you took this role, you considered it, moved here, big deal, empty nester, congrats. But when you imagine yourself kind of finishing with Brown one day, whether that's, retirement or just maybe Emory is really wanting you back, or maybe you're moving for your job at the CDC one day, who knows? But when you think about, leaving Brown one day, and I'm going to say this in a very researchy way, what variables would you use to sort of analyze how successful your time was with us, and how impactful you were in your position here at Brown?
I think I mean, there's multiple questions there, right? One of the ways I measure success, and this has been true for years, is just following students after they've come through the program. Whether it's through my courses or students that I work with on a thesis or on another project. If you were to look at my Facebook account, probably I would bet at least 3/4 of my Facebook friends are former students. So I keep up on new jobs and babies and all that kind of stuff. And the last APHA meetings in Atlanta, the most fun I had was running into old students and being able to catch up on where they were. I also hope that I'll have a positive impact on the MPH program. I'd like to see, one of the things that I think is really important, we have this motto that you learn public health by doing public health, and I would like to see that get even deeper. I'd like to see our students be able to engage more with the community around Rhode Island and elsewhere. You all, especially in the online program, are all over the country and the world. So I'd really like us to continue looking for opportunities to allow our students to learn public health by doing public health. And I'd like to see us making a difference in our community, both in Rhode Island and elsewhere. So to be able to say that through the work that we've been doing in a particular community, that we've been making a positive difference.
Yeah, I really appreciate your perspective here, and it's good to know what your goals are, right? Like, what are you aspiring to as our director, and how can we watch out for you and support you as students as well? And I guess one of them might be, keeping in touch when we're done with our program. So
absolutely, please do. Please do.
That's awesome.
Yeah.
Yeah, well, I appreciate it. I think I'm going to hand it back over to our staff here that are running the show, but I really appreciate your openness and I guess like interest and kind of giving us insight into your brain. How are you doing this? How do we do this? So thank you so much.
Thank you.
Wonderful questions from the moderators. Thank you so much. Tommy, I'm going to throw it back to you and Grace. And if you have any follow-up questions you'd like to ask, we have about 6 minutes left. Grace, you were interested in asking one more question?
I thought I was going over my time, so I wanted to make sure Zoe had enough time, but I think this is a good wrap-up question for me. People tend to have strong feelings about public health. I've done a lot of work in anti-stigma. I've also done a lot of work in harm reduction, which now is really easy to talk about and more widely accepted and metabolized by the public. But when I first started, what certainly was not the case. How do you manage to get things accomplished in the face of adversity, in the times that you faced adversity or stigma, and part of what you're going to be facing too with homelessness is seeing the stigma that people who live in homelessness face, just from having worked in that field. I think one of the really powerful thing about the project that you're doing is that I think the way through stigma is through people's stories. You're finding out quickly how, and I'm sure from other parts of your work, that those are survivors and we all can benefit from really learning from them. And I'm always, having done work in that field, like very humbled by the fact that people would be willing to share. But I think we need to, it's part of our public health responsibility to bring that to the public and remind them who these humans are that we and that we as a country don't care for, don't take care of in a very comprehensive way. And so I think to lead more public health and homelessness, also to get through some of this adversity, I just want to see, back to the question, how you deal in the face of adversity, and what you think helps you get through it, especially when you're fighting for human beings who are stigmatized, who are struggling, who are who really our systems are failing.
I think A lot of it for me is really being able to see that beauty and difficulty or pain can be seen in the same time. That, you know, the people that I'm working with, they may have stigma, they may have really difficult things going on in their lives, but they're also beautiful people. And without fail, if you give somebody a chance to talk to you a little bit, no matter where they are, you will see there is something shining in there. You will see it. So I think that's really important. You know, not even part of, a lot of what we did when we started the Photo Voice project, we set aside Friday afternoons, and I cooked every Friday afternoon, and I made enough hot food for 30 people, and they didn't all come and sit down at the same time. And I made my good food. I made, you know, I used to cook in restaurants when I was an undergrad. You didn't get that part of the story today. But you know, I made food that I would invite people over to the house for, and we had conversations. And this, you know, we went 4 weeks in a row and just engaged with people around food and the idea of taking pictures of things that are important to them in the community. And I know that, you know, I got known. There were a couple of people who were like, "Oh, she's the picture lady," because, you know, Photo Voice. There were others who was like, "Oh, that's the chili lady." So, you know, food goes a long way. And that's true in graduate school as well, I must say. For master's students, if you want to motivate master's students, offer food. So it's a little bit of a flippant response, but I do think, you know, really a lot of what keeps me focused in everyday life is kind of meditating on the value and the worth of the people around me, and trying to be true to that in everything that I do.
I love that. Thank you so much. I think
That's
sort
an
of,
excellent response.
yeah,
Excellent.
it's just,
Yeah.
and it's a lot of articulating the way I've felt about my work. So it's always just one of the reasons I loved having you as a professor and loved this session is it's
Thank
just,
you.
I see that in myself and I see that in you, and I think we need to bring that to the public more. And so I appreciate your work. So thank you.
Thank you so much.
Very good. Tommy, is there anything you would like to follow up with?
I don't really have a follow-up question, and I know we're running a little bit out of time, but I really want to you know, just take the opportunity to say thank you, Dr. Andes, for all your work, and those truly inspiring words. They definitely resonate with me as well, and I'm sure they resonate with a lot of the Brown community and the community, especially in the MPH program. So thank you for that.
Thanks, Tommy.
Thank you for having me. This is really
Appreciate it.
Yes, thank you, Karen, for giving us a part of you that many of us may not have known before, and maybe we can follow up with a Karen Andes 2.0 sometime, and you can talk about your cooking expertise.
Oh boy, fun.
And I'd like to thank our moderators. You've done a wonderful job, and it was just another excellent leadership and action series. Thank you all.
Thanks so much for
If there are
having me.
any questions, I will keep the meeting going, the Zoom call going a few more minutes, and you can put them in the chat, and I can always get them over to Dr. Andes. All right. So again, everyone, have a good evening, and thank you.
Thanks so much, everybody.
so much.
Thank you
Goodbye.
all.
Thank you
Thanks
so
for
much.
this.